Okay, go.
Alright. Hi everybody, Dr. Smith here. I'm going to be showing you how I do some Gua Sha today on Sue's foot. Sue here has been willing to let us film her little treatment here. She's developed a little bit of plantar fasciitis. This is a great treatment for plantar fasciitis. This is a tool I'll be using today. This is a Gua Sha tool, and it's made out of water buffalo horn. It comes from China. It has different shapes and different edges for different parts, but you can see here how I use it on the plantar fascia. I like to start off by lubricating the area, and I like to use a nice little herbal arnica oil, which also decreases inflammation and decreases pain. Now sometimes this can be a little bit uncomfortable for the patient as we scrape into areas of scar tissue and adhesions. Those are like little staples in the fascia that can cause the muscles to bind up and then cause pain. But overall, it'll start to feel pretty good, and the patient should feel better after the treatment. And so what I'm going to do is just kind of gently scrape along the direction. And what I'm looking for is sort of like going over train tracks or sandpaper, little bumpy feelings. And the tool helps me feel where those areas are. And a lot of times the patient can feel it too. And I feel one right here, a little bit of a bump in there. So I assume that that's a little adhesion. It's right in the plantar fascia. And now I'm going to start to put a little more pressure in there as I scrape down in there. Can you feel that little bump, Sue?
Yes, I can.
Is that too much pressure, or are you okay?
It feels great.
Good.
Actually.
Good. And I'm going to go down a little bit lower. Now we can feel a little bit more, the scar tissue is closer together, so more of like a high-pitched scraping and rubbing, more like sandpaper down here. And we just try to scrape that out, feel it start to loosen up, kind of work my way down the plantar fascia, and even put a little stretch on it to really get in there. And there's a real tight spot right there. And then it starts to feel smoothed out. And if you can get a close-up here, you might see a little bit of a redness that starts to develop. And that's a normal, safe, harmless reaction to the treatment itself. Okay. Another good thing to do would be to check the calf muscles as well, because the plantar fasciitis a lot of times is also related to problems in the Achilles tendon. So I'm just going to kind of go down here. And that feels pretty good for Sue, a little bit right there. And then check the gastrocnemius up into the knee. And pretty good, a little tight up here by the femur. Alright, and that is a Gua Sha treatment for plantar fasciitis.